So my name is Alex Taylor. I am one of the infectious diseases pharmacy practice leads at Atrium Health Wake Forest Baptist. I'm a pharmacist. I went to pharmacy school at the University of Tennessee, and I did 2 years of residency at the Cleveland Clinic in Ohio, a general first year of pharmacy practice residency, and then a second year focusing on infectious diseases before taking the job. There's three, I would say, full-time ID pharmacists at the Winston campus, and we kind of rotate through a variety of spaces. I think there's a lot of exciting things happening in the HIV space right now. I'm really proud of our clinic's involvement and kind of being at the forefront of injectable treatment and prophylaxis for HIV. And I think that space is going to only explode. So I think there's a lot of exciting things happening in research with long-acting injectables or just non-daily antiretrovirals. We spend time rounding with our multidisciplinary ID consult team, which is awesome. We have an opportunity to kind of help influence, their clinical care, particularly as it relates to their antimicrobial therapy management and monitoring and all the things that go along with effective treatment in that regard. We are also heavily involved with antimicrobial stewardship on the inpatient and sometimes outpatient side. And so we're sort of integral to the stewardship activities that happen. And that team, I think, is got a lot of close collaboration across a lot of disciplines, which is really helpful for us making informed, clinical and operational decisions as it relates to stewardship, microbiology, infection prevention. It's really a awesome merging of kind of all those disciplines to make the right decisions locally for patients. What drew me to ID was that there's never a singular right answer, that there are a lot of grays, that it's a rapidly evolving specialty, and so it's intellectually stimulating, right? And there's always a puzzle to be solved, and oftentimes multiple right answers. The best path forward is, found oftentimes through collaboration with the patient and acting on the available data. It's complex and exciting in that regard, I guess, rather than, maybe being a more cookie cutter specialty. Every single patient population is affected by infectious diseases. And so if you're someone that, likes variety and variability, I think that is something that's really exciting about ID. A tip that I give people that are pursuing infectious diseases is that it's so important to approach your career and your specialty with the lifetime learner lens, right? I think because, like we talked about, everything is evolving rapidly and changing, and there's new data coming out, we always want to learn and continue to learn and have that, I think, approach. And also recognize that ID is hard and you're never going to know everything, right? Recognizing that and appreciating that and having that approach of like, I'm hungry to learn and I always want to learn, I think is really good tip.